Dear students, okay, today we are going to discuss about the burn, right? So the burn I have divided into two sessions. First we will discuss about the causes of burn in this video, and then in the next video we'll discuss about the burn wound and the management of the burn, right? So that we have burn. So let's see over here about the burn. This is one question, we will discuss it later. This one, let's see, all the following statements are true about the inhalation burn injury except option here, direct thermal damage to the lung is commonly seen. Okay, so just careful about this direct thermal damage and lungs, right? Another one, with inhalation injury, damage is primarily from the chemical burns associated with the inhaled toxins. Particles of the smoke and toxins are carried distally into the major airways, right? Carried distally. This is another point. So let's see over here. If we have the inhalation burn, right, we have the three mechanisms of injury. Number one mechanism is what? The direct heat. Second mechanism is what? There is the smoke particles or burn particles. Third one is the poisonous effect, like carbon monoxide, right, CO, or maybe the hydrogen cyanide, right, hydrogen cyanide. Is that okay? So few things you have to understand here. Heat does not reach to the lungs. We divide the airways into the upper airways and the lower airways, right? So the heat, it causes the damage to the upper airways. Is that okay? Because heat cannot enter into the lungs. Is that clear? So that upper airway damage is caused by heat. Lower airway damage is caused by the burns. Is that okay? So the burn particles will reach to the lower airways, and then poisonous effect, you know already, they will reach into the blood, so they produces the systemic effects. Is that clear? So that our options, direct thermal heat damage to the lungs, that should be wrong. They can cause only the upper airway damage. Is that okay? And inhalation injury damage is primarily from the chemical burn associated with inhaled toxins, right? So these toxins will reach to what? The distal airways, and of course they can cause what? The distal airway damage. Is that okay? So this option is true. Particles of the smoke and toxins are carried distally into the major airways. Yes, that's true. Just now we're discussing, right? So these particles, size 1 to 5 micrometer, they reach to the lungs, and then the terminal bronchioles. Is that okay? And then they causes the damage. Hope you understand, right? So that, what is the the wrong statement over here? The wrong statement is direct thermal damage to the lung is commonly seen. No, the direct thermal damage produces the damage into the upper airways. Hope you understand, right? So this is the point. Now let's go forward. So let's see over here some the overview. Burn is acute traumatic injury to skin plus minus underlying tissue, and that is due to different causes. We are discussing about the causes of the burn, right? So heat or heated object. Let's understand over here. If there is the heat or heated object about 44 degrees Celsius, it causes the protein denaturation. Is that okay? This protein denaturation later on causes the cell death. Hope you understand, right? The first point to understand about the heat or heated object. Another point is that if 44 degrees Celsius heated object is exposed to our body for more than 6 hours, it causes the skin necrosis, right? So this point you have to understand. And if this 70 degrees Celsius heated object exposed to our body only for 1 second, right, it causes the same effect, the skin necrosis or the cell death. Is that okay? Or cell death. Is that okay? So that while catching the heated object, You have to be very much careful. Is that clear? So that means they are causing what? Irreversible cell death. Hope you understand, right? So this is the question they will ask you in the exam. So for the irreversible cell death, 44 degrees Celsius or 70 degrees Celsius. 44 degrees Celsius for 6 hours or 70 degrees Celsius for 1 second, they can cause our what? Irreversible cell death in the body. This is the question they will ask you in the exam. Hope you understand. Another cause is the flame burn, right? Another cause is what? The flame burn. Understand over here, flame means you know already, directly burning object, right? So this flame burn is the most common cause of burn in adult. Most common cause of burn in adult is what? The flame burn. Hope you understand, right? And then this flame burn, it produces the full thickness burn. This is question in the exam. Okay, so flame burn produces the full thickness burn, and this is the most common cause of burn in adult. Please remember this one. This is the question in the exam. And here we discuss about the 44 degrees Celsius and 70 degrees Celsius. Remember this one. For more than 6 hours, for more than 1 second, irreversible cell death. Question in the exam, upcoming FMG. Please remember this one. After that, let's see over here, electricity burn, electric burn, right? See, our body is what? Insulator, or we can say the bad conductor of electricity. Bad conductor of electricity. If it is bad conductor, it produces what? Resistance. If it produces the resistance, if you know your physics, right, resistance produces the heat, right? So this heat produces the burn. So remember, the more deeper, the more resistance. The more deeper, the more resistance. More resistance, more heat. More heat, more burn. That's why electricity produces deeper burn. Please remember, outside, when the patient comes to you with the electric burn from the outside, the skin may remain intact, but internally the muscles, the nerve, and then your what? The bones are damaged. So that you have to be very much careful while assessing the electric burn patient. Similarly, electric burn also produces the cardiac arrhythmia. Cardiac arrhythmia. So this, the management of these burns we will discuss later. So please be careful on that. Similarly, some other causes like the chemical burns, right? Chemical burn, first one is the scald. Scald means you have to understand it is what? Wet hot object. Wet hot object means, example, maybe fluid or liquid, or maybe the stem, right? Stem burn, right? So this is called what? The scald burn. And scald burn is the most common cause of burn in the children. Please remember, this is a question in the exam. Most common cause of burn in children is what? The scald burn. This is a question. Please remember. And another point is that the fat, right? So you have to understand. Yes, and the scald burn, it produces the superficial burn. Please remember, superficial burn. Another one is fat. Fat, you know, the specific heat capacity is less than water, so that it can easy to gain the heat, easy to lose the heat. Another point, the fat viscosity is higher than the water, so it will remain in the skin for longer. If it remain in the skin for the longer, it can transfer the heat to heat longer. It can transfer heat longer. So if it transfer heat longer, it causes the more deeper burn, so that the fat burn is more dangerous than the water burn. Hope you understand, right? What are the reasons I said? Easy to gain the heat, easy to lose the heat. So when it come into the contact to your skin or the body, it can lose the heat faster, so that causes the more burn. Similarly, the viscosity, it is more viscous than the water, so that it can remain intact within the skin for longer time. If it remain intact within the skin for the longer time, what happens? It can transfer the heat for the longer time, produces the deeper burn. So hope you understand, right? Similarly, alkali or cement. Cement is also alkali, right? Basic substance. The alkali or cement, it produces the liquefactive necrosis. So it causes the tissue necrosis by the liquefaction, dissolution, so that it can produces the deeper burn. Please remember, this is also the question in the exam. What kind of burn is produced by the alkali or cement? Similarly, acid burn. Acid burn produces the coagulative necrosis, right? So if it produces the coagulative necrosis, what happens? It produces the scar outside in the skin. Scar means thick, the thickness of the damaged tissues will be here, so that the acid cannot penetrate deeper. Is that okay? So does not go deep, so it produces the superficial burn. Similarly, water, let's take a reference of water of 65 degrees Celsius, right? So the water of 65 degrees Celsius, if it exposed to our body for 45 seconds, it produces the full thickness burn. Full thickness burn. If it exposed to our body for 15 seconds, right? 15 seconds is not degree Celsius. 15 seconds, it produces the deep partial thickness burn. Deep partial thickness burn. And if it exposed to our body for 7 seconds, right? 7 seconds, it produces the superficial burn, right? Hope you understand. So this water, acid, alkali, fat, skull, electricity, hope you understand, right? And here in the electricity, some more points I want to add over here. Let me clean this one first. So in the electricity, you understood the mechanism. If we expose to less than 1000 volt, right, it is the minor electric burn. If we expose to more than 1000 volt, it produces what? The major electric burn. This is the classification category they will ask you in the exam. Is that okay? So please remember this one. After that, let's go to the radiation burn. Radiation. The sources of radiation may be environmental, right? Environmental, or it may be the therapeutic, right? Radiation exposure in the hospitals. For example, you are doing the cancer radiotherapy, or maybe you are the staff working in the radiation or the radiology department in the hospitals, right? Or environmental, maybe you have the UV radiations. Is that okay? So these are the sources of the radiations. And this radiation burn, it produces the burn by the alpha particle, beta particle, or the gamma particle. So look at here, alpha particle cannot penetrate skin, so it produces the erythema, that is first degree burn. First degree, the classification of the burn we will discuss later. It produces first degree. This is question in the exam. Is that okay? Superficial skin erythema, that is first degree burn by the alpha particles, because it cannot penetrate the skin. Similarly, beta particles, they can penetrate up to 2.5 centimeter, that means 1 inch depth of the skin. Is that okay? So it produces the slightly deeper tissue injuries. Gamma particles, they can penetrate up to 30 centimeter. Remember, so 30 centimeter they can penetrate. 30 centimeter means they can penetrate throughout the body, so that they produces what? The deeper tissue injuries. Deeper tissue injuries. So please remember, these are the questions in the exam, right? Alpha, beta, gamma particles, how much deep they can penetrate and they can burn, right? So please remember this one. And let's see over here, these radiation, these particles, the tissue injury depends on the how long these radiations are exposed to our body, or at what dose they are exposed to our body, right? So depending on this one, we decide the cancer chemotherapy as well, how much the dose of the radiation should be given, at which deeper the body organs the cancer is involved, right? So that look at here, if we expose to more than 3 gyrate, gyrate is the unit of the radiation. This is a question in the exam. And remember, 1 gyrate is equal to 100 rad. This is the another unit of the radiation. They will ask you in the exam, right? So these are the unit of the radiations, right? Radiation energy. and 1 gyrate is equivalent to how much? 100 rad. So these are the questions in the exam, please remember. Okay, so if we expose to more than 3 gyrate, they will produce what? The alopecia. Alopecia means you can see the loss of hair. You can see this one, right? Loss of hair. If you expose to more than 6 gyrate, then it will produces the erythema. Erythema, look at here, you can see the erythema, the skin color changes, right? If you expose to more than 10 gyrate, it produces the dry desquamation. Dry desquamation means you can see the exfoliation of the skin, right? No discharge. And more than 15 gyrate, if you expose, it produces the wet desquamation. Is that okay? So wet desquamation means you can see over here there is a discharge, there is edema production. Here is no edema, no edema. That means dry desquamation, right? So more than 15 gyrate, it produces what? Wet desquamation. If you expose to more than 20 gyrate, then it produces the cell death. Cell death. If you expose to more than 30 gyrate, it produces what? The tissue necrosis. Hope you understand, right? And as we said already, the extent of the tissue damage depends on the dose and then the the time, how much the radiation is exposed to the body. Is that clear? So here one point I want you to explain over here. If we expose this radiation for 15 minutes, right, this 15 minutes exposure, it produces the thymine, Thymine. I don't know the spelling. Thymine dimerization, right? Thymine dimerization means, hope you understand, right? We have the the adenine, right? ATCG, right? So this kind of, we have the pairings, yes or no, right? So like this in the DNA, so we have the adenine, thymine, cytosine, and then what is this one? The what is this one? Guanine, right? So that in this case, what happens if we expose this radiation for more than 15 minutes? This thymine, for example, we have another thymine over here, C, and we have the T over here, right? So this kind of thymine dimerization occurs. Thymine dimerization occurs. If this thymine and thymine dimerization occurs, then during the the DNA the replications, the DNA cannot get replicate. Do you understand? If the DNA cannot replicate, then the cell cannot divide. If the cell cannot divide, then if the one cell died, then it will die, right? So that there will be no other daughter cells formation. So that if we expose these two for more than 15 minutes, then what happens? Thymine dimerization. Please remember, this is a question in the exam. Thymine dimerization. So that this thymine dimerization, it produces the inability to DNA replication. Inability to DNA replication means the cell cannot undergo the division, right? And mostly the radiation, it affects the highly dividing cell, highly dividing cells like stem cells, right? So that the stem cells has the mitosis. If the mitosis is stopped, then the stem cells cannot divide. If they cannot divide, then the cell regeneration cannot occur if you have the wound or any injury in the body, right? So that this is very critical. Another point, this thymine dimerization produces the cell death. Cell death produces what? Increases the reactive oxygen species, that produces the more inflammation to the tissues. Hope you understand this one, right? Now let's go to the the radiation burn continue, right? So we have the most sensitive to radiation. So what are the cells they are most sensitive to radiation? That I said already. Highly dividing cells in the body. Highly dividing cells in the body. For example, bone marrow cells, or other tissue stem cells, right? Plus within the skin we have the hair follicles. You can see over here, hair follicles, right? We have the where do we have here? The basal keratinocytes, right? In this epidermis we have the basal cells over here, these basal keratinocytes, which are continuously dividing, right? Continuously dividing. So these basal keratinocytes, they are more sensitive. So what are these sensitive cells? Bone marrow cells, similarly stem cells, similarly the basal keratinocytes in the skin. Similarly we have the melanocytes in the skin, melanocytes. Similarly we have the hair follicles, in the skin. That's why we discussed already, if we expose to more than 3 gyrates radiation, we get the hair loss. right? Because hair follicles are more sensitive to what? The radiations. That's why these are the question in the exam. They will ask you, is that okay, which are the most sensitive cells to the radiations in the body? And by this what happens, they produces the, by the radiation they produces the acute changes or the chronic changes, right? So this acute changes, they may heal within 14 days, within 14 days. By the acute changes, they produces the erythema, right? This erythema may flare up after the exposure. If the the radiation exposure we stop, then after 1 hour it begins to heal, and by the 14 days it will heal completely. The chronic changes it may produces, like the chronic burn marks, or the skin changes, pigmentation they may produce, right? And they produces also the thrombosis and ulceration, thrombosis and ulceration, right? Ulceration, right? My handwriting is not clean, so please be careful on this one, right? So these are the changes. So what are the source of radiation? We discussed already. That is what? The environmental source, or maybe the artificial source, like we discussed already about the radiotherapy. We expose in the radiations, right? So let's talk about the environmental source. Environmental source, we discussed here about the UV radiation, right? So UV radiation, we divide this into 3 categories. Is that okay? So we have the UVA, you have the UVB, and we have the UVC. UVA, that means ultraviolet ray A, type A, ultraviolet type B, ultraviolet radiation type C, right? So that, let's discuss on this one. Ultraviolet rays type C, they do not reach to Earth, the Earth, right? Because they are absorbed completely by the ozone layer, so that they are not harmful to us, right? Now UVA and UVB, out of the total radiation they reach to the Earth, about 95% of the radiation, UV radiation reaching to the Earth, is type A UV radiation, and about 5 to 10% of the UV radiation reaching to the Earth is what? Type B UV radiations. Is that okay? Hope you understand. And another point you have to understand is that UVA is less energetic and high wavelength, long wavelength, high wave, LENGTH, right? That is, their wavelength is about 320 to 400 nanometer. Is that okay? They damage deeper dermis. That is UVA radiation. Hope you understand, right? And then UVB radiation, about 5 to 10% of the UV radiation reaching to Earth is what? UVB radiation. They are highly energetic, but they have the short wavelength. Short wavelength means about 290 to 320 nanometer. This is easy to for you to remember. See, 320 starts from here, 320 ends over here, right? So this, you hope you understand. And this radiation, they get completely absorbed by the epidermis, right? So that they do not reach to the dermis, Hope you understand, right? So they are completely absorbed by the epidermis, and they reach maximum deep to the stratum, the corneum, mostly stratum corneum absorb them, right? So that you understand, right, about the, because the layers of the skins, right? So we have different layers of the skin. What are those layers of the skin? You can remember, like stratum corneum, stratum lucidum, right? Stratum granulosum, stratum basilis, right? So these are the different layers of the granulosome, after the spinosome, stratum spinosome, then only stratum basalis. So hope you understand the layers of the skin as well, right? So stratum corneum is the most superficial. Deeper you go, you will get the stratum lucidum. The more deeper you go, stratum granulosum. More deeper you go, stratum spinosome. More deeper you go, the stratum basalis, right? So these are the layers of the skin, you will understand, right? So these are the UV radiations. So what are the pathophysiology of the UV radiation? Look at here. UV radiation, they produces the acute effect, and then they produces the chronic effect. So acute effect and then chronic effect of the UV radiations. Let's see. Acute effect of the the UV radiation. This UV radiation we discussed already. UV radiation C does not reach to the Earth. UV radiation A and B reach to the Earth, right? So that UV radiation A, UV radiation B, UV radiation B. What is the role of the UV radiation A? UV radiation A, actually what does it do? UV radiation A causes the melanin, right? It causes the melanin photooxidation. So it produces what? The pigmentation. It produces the pigmentation. Right? And this pigmentation will flare within an hour of the exposure, if we stop the exposure, right? But if this exposed for longer, right, then it may produces the residual pigmentation. So please remember this one. This is about the UVA acute effect. And UVB acute effect, remember, see, UVA is doing only the photooxidation of the melanin, but UVB is causing the neomelanization. Neomelanization means it forms the new melanin, increase the number of new melanin formation, new melanin pigmentation formation, increase the production of the melanin. Here produced melanin undergoes the photooxidation, but here number of melanin pigments increase, production of the melanin is increased in case of UV radiation B. So that this takes time is about 72 hours. Is that okay? Here UVA radiation, it is causing only photooxidation, so this photooxidation begins immediately or within 4 to 24 hours. So by the UVA, the melanin photooxidation begins by 4 to 24 hours. When we expose to the radiation for 4 to 24 hours, then the melanin the photooxidation begins. That means if we expose to the radiation less than 4 hours, pigmentation does not appear. Please remember this question in the exam. In case of UV radiation B, when we expose to more than 72 hours, new melanin pigment formation begins. The amount, the quantity of the melanin also increase. Then of course by the the UV radiation A, it causes the photooxidation, then the pigmentation will be increased, right? So why this pigmentation formation increase? Because this pigmentation can protect the nucleus of basal keratinocytes. Right? So we were discussing this one, right? Basal keratinocytes increase, protect the nucleus of basal keratinocytes. Hope you understand, right? So that this is important. This is the acute effect. Now let's go to the chronic effect. In case of the chronic effect, right, this chronic effect will produce the irregular pigmentation. This irregular permanent pigmentation is also called lentigens. And also it causes what? The tissue necrosis. Tissue necrosis produces the ulceration, skin ulceration, right? So this produces this kind of the problems. Similarly, what does it do by the chronic exposure? It causes the activation of the inflammatory cells like the neutrophils or macrophages, that produces the lysozymes, right? These lysozymes, when they are activated, they inhibit the elastase and collagenase, so that old collagen fibers, they cannot get turnover. So what happens? Increase collagen type 3 is to collagen type 1 ratio. Do you understand? Right? So the normal ratio of this one is collagen type 3 is 20%, collagen type 1 is 80%. This collagen type 1 is giving the normal strength to the skin. But when we expose to the the radiations chronically, it produces the lysozyme. That lysozyme is produced by the inflammatory cells like neutrophil and macrophages. This lysozyme inhibits the elastase and collagenase. This elastase and collagenase, if it is inhibited, then what happens? The old collagen cannot get turnover, so that collagen type 3 is to collagen type 1 ratio will increase. Collagen type 3 and type 1, usually the normal ratio is 20% and 80%, right? Type 3 is 20%, type 1 is 80%. That type 1 gives the normal skin strength. But by this condition, when the collagen type 3 ratio increases, it produces the skin wrinkle. So hope you understand how the radiation exposure produces the wrinkling of the skin and produces the early aging. Hope you understand. That's why use this sunscreen. Don't get your skin wrinkle. Right. So these are the chronic effect of the UV radiations, and you can see this is the acute, this is the chronic effect. You can see over here, right? The ulcerations, pigmentations. Here you can see the sunburn. These are the the sunburn area where the patient with the maybe the inners over here, and then this area is exposed to the sun, right? And there is one very interesting game in the Europe. The people has the sunburn competition. Sometimes you can watch in the YouTube as well, right? Let's see over here something about the caustic injuries, right? So these caustic injuries, we see over here 3 types of caustic injuries, that is acidic injury, alkaline injury, or maybe the chemotherapeutic drugs injury, right? So in this we have the acidic injuries over here. Acidic injuries, you know already, acidic injuries produces what? The coagulative necrosis, so that they produces the scar, ESCHAR, scar, the thick the scar over the skin, so that they do not penetrate deeper, right? So they do not penetrate deeper, right? This is acid burn. But there is one exception, that is what? Hyaluronic acid, HYALURONIC, hyaluronic acid burn, right? Hyaluronic acid burn produces the liquefactive necrosis. Remember, for example, liquefactive. Rest of other acid produces the coagulative necrosis, but the hyaluronic acid produces the liquefactive necrosis. This is question in the exam. Similarly, we have the formic acid. Right? So the formic acid, it produces the hemolysis, and then the hemolysis and hemoglobin urea. If there is hemoglobin urea, it produces the acute kidney injury. Hope you understand, right? Later in your pathology, you can discuss about the acute kidney injury or tubular necrosis. That is because of the the free hemoglobin, free iron released from the hemoglobin. So formic acid produces what? Hemolysis and hemoglobin urea. Similarly, we have the another, that is the hydrofluoric acid. Hydrofluoric acid. Hydrofluoric acid binds with the ionizing calcium. So if it binds with the ionizing calcium, it causes the hypocalcemia. Is that clear? So that if the patient comes to you with a hydrofluoric acid burn, then patient will produce a hypocalcemia. You have to be careful in management. Similarly, we have the alkaline solution burn, that we know already. Alkaline solution produces what? Liquefactive burn. This liquefactive necrosis or liquefactive necrosis, that produces the deeper tissue injury. Hope you understand, right? After that, chemotherapeutic drugs. These chemotherapeutic drugs, when we are injecting the chemotherapeutic drugs to the patient, 0.1 to 0.7% cases, these drugs may spill out, maybe because of our faulty technique of the injections, right? So this produces the erythema of the skin around the injections, right? So hope you understand. So overall, the caustic injury it produces about 10% of the burn injury, and about 30% of the burn related death is by the the caustic injury or the chemical burns. Hope you understand, right? And you can see over here the picture. Acid burn produces the coagulative necrosis, alkali burn produces the liquefactive necrosis. You can see from the outside you see nothing, but it has the deeper tissue injuries over here in the alkali. But acid, you can see from outside, you can see there is a the coagulative necrosis, right? Now let's go to the inhalation injury. Inhalation injury means when you are exposed to the chamber, right, stuck in the chamber, or sometimes you have the burn, the catch fire in the building and you are stuck inside the room, right? So this kind of things, or maybe you are cooking or doing something else and you got the stem, right? Inhale the hot steam, inhale, so this produces the inhalational burn, right? So this inhalational burn produces the the wound, or the injury, in three mechanisms. That is direct heat injury. Number two, it produces the inhalation of the combustion products like the toxins, we said already, smoke particles, right? And it by the poisonous effect, right? So this is the three mechanisms of the inhalational burn. Direct heat injury, right? Heat directly produces the injury to the upper airways, to the upper airway. So direct heat injury produces what? Upper airway edema. Upper airway edema. So this upper airway edema may produces the dyspnea. May produces what? Dyspnea and stridor. STRIDOR. So we have to go for what? Intubation. Hope you understand, right? So this is one mechanism. Please remember, question in the exam. And second mechanism is by the toxins, right? So if the toxins, when the size is 1 to 5 micrometer, this 1 to 5 micrometer size toxins, they will directly go into the terminal bronchioles. Terminal bronchioles. They causes the lower airway damage. LAD I write over here. Lower airway damage, right? So that this they go directly to the bronchioles. Once they go directly to the bronchioles, they causes the irritation. This irritation causes what? Reflex bronchoconstriction. Reflex bronchoconstriction. And then difficulty in breathing difficulty, right? Breathing difficulty. This is the second mechanism. And in the third mechanism, poisonous effect, right? Here one more thing I have to explain over here in the inhalational effect, right? So one mechanism is this one I explained. Another mechanism is also here, I nearly missed. So one, irritation and the reflex bronchoconstriction. Another effect is that they causes the release of inflammatory mediators at the alveoli. That causes what? The bronchial vasodilation, bronchial or pulmonary vasodilation. They causes the pulmonary edema. This pulmonary edema, they produces what? The crepitus. So look at here, crepitus present, lower airway. Stridor present, upper airway. Upper airway is because of the direct heat injury, and lower airway injury is because of what? The combustion products, the toxins, because of the burn toxins, right? So hope you understand mechanism. Third mechanism is poisonous effect. In the poisonous effect, we see number one, CO poisoning, carbon monoxide. See, carbon monoxide has the affinity to the hemoglobin about 200 to 250 times more than that of the oxygen, so that it will replace all the oxygen from the hemoglobin. If it replaces all the oxygen from the hemoglobin, then what happens? It produces the anoxia. This anoxia causes the death of the patient. This is one mechanism of the carbon monoxide, right? Second mechanism of the carbon monoxide is that it goes to the ETC in the mitochondria, right? ETC in the mitochondria. Once it goes into the ETC into the mitochondria, it causes the separation of the oxidation and phosphorylation. Phosphorylation. That means oxidative phosphorylation is dissociated. Oxidation goes on, but phosphorylation does not take place. Phosphorylation means no ATP formation. ATP formation does not occur. Is that okay? If ATP formation does not occur, energy, the ATP energy release does not occur, only it produces the heat. It produces the heat. Hope you understand, right? So that this patient's increases what? The reactive oxygen species. It increases the reactive oxygen species, increase ROS in the body. Is that clear? So this is the CO poisoning. At the same time, it produces the hydrogen cyanide poisoning as well by the burn. Hydrogen cyanide poisoning. Hope you understand, right? So this, what does the hydrogen cyanide do? This hydrogen cyanide, it also goes to the mitochondria and it inhibits the cytochrome oxidase. Cytochrome oxidase of the mitochondria. Once it inhibits the cytochrome oxidase of the mitochondria, what happens? The Krebs cycle does not run, so that increase lactic acid. Increase lactic acid. So patient will suffer from what? Lactic acidosis. Patient will suffer from what? Lactic acidosis. And the classical sign of this, the hydrogen cyanide poisoning, patient will produce what? Bitter almond breath. Bitter almond breath. Patient will produce what? Bitter almond breath, plus patient will show cherry red skin. Cherry red skin, right? So cherry red skin, if you see, and the bitter almond taste usually comes in the hydrogen cyanide poisoning, and cherry red skin will be seen in case of what? Carbon monoxide poisoning, right? So these are the pathophysiology of the inhalational injury to the patients, right? So what are the signs of the inhalational injury? If the patient has the inhalational injury, comes to you, first thing you have to see around the face. So what will you see? Patient has the burn around the face, right? So what will you see? Burn around the face. If there is no significant burn around the face, what will you see? You will see the loss of eyebrow, right? Eyebrow burn or loss. You will see the sign nasal hair. Nasal hair may be signed, right? Sign means what happens? Half burned hair will become white at the tip where it is burned. So that is called what? Signed hair, nasal hair. Similarly, you will see the soot around the mouth or nose. Soot around the mouth or nose, right? So you will see the oropharyngeal erythema. Oropharyngeal erythema. You can see, you can inspect the patient, and you will also see the carbon deposits. That means the black deposits around the face, inside the nose, or inside the mouth, right? Carbon deposits. That means we also say charcoal deposits, right? So this kind of things you will see, and you will see, right? Yes, stridor may present in the patient. Stridor, that we discussed already the mechanisms, right? Because there is the broncho edema. Because of the bronchoedema, what happens? The airway becomes narrow. Because of the airway narrow, the air passes through the narrow airway and produces the sound, that is stridor, right? So this kind of sign you may see. But to develop all of these things, it may takes 1 to 5 days. How many days? 1 to 5 days. So that you have to observe this patient at least for 24 to 48 hours. If they deteriorate, then you have to go for what? Intubation, the next best step. That is what? Intubation. But do not intubate at this stage. You just wait, observe the patient for 24 to 48 hours. If they develop any, the critical conditions, if they deteriorate, then only you go for what? The intubations. Similarly, this patient may present with some other features that I'm going to tell you. Maybe GCS less than 8 during the presentation, right? Similarly, they may produce persistent hypoxia despite of what? 100% oxygen therapy. Patient develop persistent hypoxia. SpO2 does not rise, does not go more than 90%, despite we are giving the 100% oxygen. Similarly, patient may develop the ARDS. ARDS means what? Acute respiratory distress syndrome. That means patient may develop the ratio of PaO2 is to FiO2 less than 300. This is a mild case of ARDS. This is also called acute lung injury. What is this called? Acute lung injury. This is also a question in the exam. What is acute lung injury? If we have PaO2 is to FiO2 ratio less than 300, then we see this is what? Acute lung injury. This is also called the mild grade of ARDS, acute respiratory distress syndrome. It is because of what? The toxins. The toxins, they are causing the alveolar damage, alveolar injury, right? So patient may present with these features, or patient may have the subjective dyspnea. Subjective dyspnea. Patient may feeling difficulty in breathing, even though patient has the oxygen saturation normal, but patient is feeling what? Dyspnea. Then if the patient comes to you with these features in case of inhalational burn, you have to go for what? Immediate intubation. So these are the absolute indication of intubation in case of inhalational burn. These are the question in the exam. So what are the absolute indications? GCS less than 8, hypoxia despite of the 100% oxygen, ARDS patient develop, that is PaO2 is to FiO2 ratio less than 300, and a patient has this subjective dyspnea, then go for immediate intubation, right? Another point they can ask you in the exam over here, what is the next best step in case of inhalational burn? Answer should be what? Intubation. Next best initial step, that is what? Intubation. Next question they can ask you, what is the best investigation of choice in case of the patient with burn? Then we should go for what? Bronchoscopy. Bronchoscopy. This is another question in the exam, right? So when we do the bronchoscopy, we see the different stages in case of inhalational burn. So these different stages we categorize into 4 different parameters. Number 1, we see the erythema. Number 2, we will see the edema. Number 3, we will see what? The bronchoria, that means secretion. Bronchoria. Another, we see bronchial obstruction. On the basis of the presence of these 4 features, we categorize the inhalational burn into different grades, right? So let's see. Grade 0, number 1. Grade 0. Under the bronchoscopy, if these all are negative, all those 4 parameters are negative, then we say this is what? This is our grade 0 inhalational injury. Next one, we see the grade 1. Grade 1 means we will see the PATCHY, patchy erythema, plus minus there will be the secretion, bronchoria. Then we say this is what? The grade 1. Grade 1 is mild. This is mild grade of the inhalation injury. Sometimes we see the grade 2. Grade 2 means there will be the inflammation or complete erythema, inflammation we see, plus we will see the bronchoria will be there, bronchoria, right? Plus minus there will be the edema. Edema means the obstruction, right? In this case we say this is what? The grade 2, or this is a moderate stage. Which state? Moderate state. And yeah, of course, in these 2 conditions, we will see the carbon deposits. Carbon deposits, right? That means the black deposits will be there. And grade 3. Let's go to the grade 3. Grade 3 means all of these grade 2 will be there. Grade 2 plus there will be the slowing. There will be the slowing. Slowing means the mucosa becomes very frail, easily they sets off. Plus there will be the obstruction, but this obstruction is due to the edema, not because of the debris, not because of the slowing, right? So this obstruction will be there. So this is what? Severe. And we go for grade 4. Grade 4 means we say it's a massive inhalational injury. In this case, what happens? They will present with grade 3, plus there will be the necrotic tissues. You will see necrosis will be there. This necrotic tissue produces the obstruction of the bronchus. Is that okay? So this is grade 4, right? So grade 1, 2, 3, 4 we have to understand, right? About the inhalational burn. These are the questions they will ask you in the exam. Grade 1, grade 0, grade 1, grade 2, grade 3, grade 4s. Is that clear? And all of these grades are categorized on the basis of 4 parameters, that is erythema, edema, bronchuria, and then the obstruction. Hope you understand, right? So we have the gradings over here. You can see non, mild, moderate, or severe. We go like this, right? So classifications according to the the surgeons, they classify differently. So you can see this is the grade 0. You can see under the smoke, but there is no erythema or no edema, nothing else present. Carbonaceous product, you can see carbonaceous product, you can see carbonaceous product, you can see, right? You can see the complete necrosis, black necrosis over here, right? And complete obliterations, right? So if there is grade 0, you can wait, observe the patient. If there is grade 1, 2, 3, 4, that means this is suspicious inhalational injury or confirmed inhalational injury. Go for intubation. Go for intubation. Do not take a challenge, right? So hope you understand this gradings of the inhalational burn, right? So these gradings, they all takes time to develop, 4 to 24 hours. 4 to 24 hours. So that please observe the patient for at least for 24 to 48 hours. So if you understand, so we did the classification of the the causes of the burn, and then the inhalational burn grading. Now the burn wound, and then the classification of the burn wound, we will do it in the next lecture. So keep watching, keep following the diversity. Thank you very much.